Let's get started, Nurse Linda.
And this is real general stuff. We're not topic specific, just because I can get more people, and sometimes people don't even know what they want to ask. And they're like, yeah, that was a good question. I didn't even think about that. So I like this general free for all. And you guys really gave us a lot to work with. So that's good.
Yes.
But listen, if we don't hit your question, or you have follow-ups and we're already gone, remember I'm in the Ask an Expert question area. So if you guys want to throw something out there, please feel free. I'm always there. Okay, I'm just going to kind of read through. So I apologize as I look away from you guys as I read your questions. All right, so first question is a great question. And somebody is asking, what is the difference between quantitative tests and regular LH-OPKs, or what is called qualitative? And of course, we have both as well. And they ask, when would you suggest switching or adding the more advanced ones? Okay, so for me, I would go right for whatever's going to give me the best result. So that is going to be your quantitative test. And I believe, and Terry, correct me if I'm wrong here, but Premom may be the only one who makes a complete quantitative test. I know like Clear Blue Easy, it's kind of quantitative, but like they won't give you a number over 25, but it is quantitative in that they're looking at that. So I think some are semi-quantitative, but yeah, go with the quantitative if you can, which is the Premom brand, just because it's going to be a little bit more accurate. It's going to zone in on things sooner. You know, I just don't want to waste anybody's time. Not that qualitative waste time, of course. But again, I'd go right for that one. Okay.
Yeah. Let me jump on a little bit there.
Yeah.
Yeah, we in particular, we like to recommend the quantitative to those who have trouble finding their peak with the regular test, because for many users, they can just use the easy at home test line to control line ratio. But for some women, they get multiple peaks or they have a longer surge, and sometimes it's hard to tell exactly what the highest point of their surge is. So that's when the quantitative can be more valuable, because it gives you that exact LH number as opposed to that ratio comparing the test line to control line. Like Nurse Linda said, some people want to go right for the quantitative. They're like, I want to get pregnant now. I want what's the best out there. Give it to me. And there are other women who will use both. They'll start with the easy at home, the qualitative, that's the test line to control line ratio. And then as they're getting closer to their peak, they'll switch over, like when they're in their fertile window. So I just wanted to add that.
Thank you. All right, next question. And this is a good one because this I get all the time. And somebody's trying to understand their LH numbers. Why is a number considered low in one cycle, and then in the next cycle it's high, or it's my peak? So good question. Because your body is a little bit different each month. And the first thing I want to say is a peak is a peak is a peak. I don't care what the number is. Some people have said, I peaked last time and it was like 2.4 and now I peaked at 1.2. So is that did I not ovulate as good, or is that not a good egg? No. Whatever your body needs for an LH surge for that month to get you to ovulate, it's only doing it one time in the month. Whatever it says it is, and that's good enough. Don't care what the numbers. This is not like a pregnancy test, right, where your numbers really do matter. It doesn't really matter. As a matter of fact, part of me wishes numbers weren't even on the charts, just so we could know the numbers and let the app, which is a smart app, know the numbers so we can make a prediction, not prediction, but a decision. But so it doesn't matter what the numbers are. That's the really short answer. The longer answer is, the app is, sometimes you'll see the peak, and like Terry kind of just mentioned, there's multiple peaks. Well, you really don't ever have a multiple peak in a cycle, simply because you only ovulate once and you only have one LH surge. The app is trying to figure out what that is, though. You know, I had a gal I answered a question for in Ask an Expert today. And she was like, okay, I've had like 3 peaks in my cycle. Well, what she means is her peak has moved, and this is her third one. First, and it was like she was like 0.91, and it said, oh, that looks like a peak. I'm going to call that peak. And they did their little baby dance. And then like 2 days later, it went to 1.3, and it went, oh, erase. 0.9 wasn't it. Just kidding. Turned that into a high and made her 1.3 a peak. And don't you know, like a couple of days later, the exact same thing happened. And so Did she have 3 peaks? No. The app is trying to figure out which one is her peak, and she kept getting higher, so it kept changing its mind. Listen, as long as you're having sex during the peaks, okay, maybe you waste a little sex on the first peak or something, but that's not going to hurt anybody. Just keep responding to the peaks. Eventually, the app, she was also, by the way, new to the app, so the app is getting to know her. Now it knows she peaks at 2.3. So when it says 0.9 next month, it's not going to call it a peak because now it knows what she's like. So that's kind of how the numbers work. There really aren't multiple peaks in a cycle. The peak can move as it learns about you.
Yeah,
Okay.
Make sure you keep testing for sure, because the app is looking for a value of about 0.8 or higher. So it wants to give you a little bit of leeway room there when it's looking for your peak. And then it looks for that drop the next day. So if you get 0.8 or higher and then you drop, it's like, oh, you probably found your peak. But I love your example, Nurse Linda. If it's not your peak, if it sees that you got a higher result, it will adjust. So make sure you've tested enough to find your last highest result. If you're not sure, keep testing a little longer. It can't hurt.
Especially in the beginning, huh? And like if you're new to this,
yes,
keep doing it, because the more you test, the smarter the app is getting about you. And maybe down the road, and I hope you're not here down the road, but if you are here down the road, the app has gotten a lot smarter, and you might find you don't have to test every single day after you have your peak type of thing. This is also another reason why it's a good idea to do BBT, because if she were doing, which she wasn't, but if she were doing BBT, she would see that her temperature didn't go up at all with those 2 fake peaks, but it did go up. It would have went up with the third real one. Here a gal asked me, how soon after ovulation should we expect the BBT to rise? It takes maybe 1 to 2 days before you see that BBT go up a little bit. I mean, these are small amounts, but when you have an ovulation BBT, you're definitely going to see this, right? It comes along, toodles along before ovulation, and then after ovulation, it goes up. Now it's tootling along over here. So you'll see this difference like this. And that's what confirms you ovulated. But it takes about a day or 2 for that to go up. Somebody asks, I'm wondering how an implantation dip looks for BBT. Now, yes, implantation dip for BBT is a real thing, but women who get pregnant don't have it. Women get it who don't get pregnant. So it isn't like it's 100% reliable and count on it. It's not. But sometimes you will see. When does implantation happen? Well, the big answer is anywhere from 6 DPO to 12 DPO, but on average, it's around 8 or 9 DPO. But you might see an implantation, and again, like 0.3 degrees, it might go down. But it's only for like a day if it happens. Just don't get OCD on me and think you have to see that or you're not pregnant. Okay. When is the best time to baby dance when checking for ovulation? So let's just answer the baby dance question, which is going to be a lot of my questions here. So sometimes you hear and read, you should have sex every other day. Sometimes you hear and read, you should have sex every day. There's no wrong answer. And I'm going to tell you, most certainly, it depends on our partner, right? Okay, pressure. If you know pressuring him every day is going to backfire, then don't do it. Any amount of sex is better than no sex. And, we don't need him to feel that pressure. And of course, when we come along and we start pressuring him, that does wonders for making it not happen. So we can't do that. I push for daily intercourse. I'm in that camp. When? Well, the idea is we have this fertile window, right? And the fertile window basically is dependent on how long sperm live, and sperm can live up to 5 days. So if you start having sex 5 days before ovulation and have sex every day, and I even say, tag another one in after the day after ovulation, since the egg can live for up to 24 hours, you're looking at like 5 to 6 days of daily intercourse is what I would recommend. Now, sometimes it's not easy to tell. Well, how do I know when 5 days before ovulation is? Well, sometimes your kits might, start hitting highs. But honestly, if you've been watching your ovulation or how your cycles work, basically ovulation is 12 to 14 days before when you're expecting your period. Most gals know when to expect their period, so you can kind of count back. but that's my recommendation for sex. Also, I'm going to throw in, because this was asked, it's a question later, should I be laying down? Should I have my legs up in the air? Again, different camps on this. I do think that, and this is just logic, sometimes when you keep reading different opposite answers, stop, read them both, and then logically think about what might make sense to you. And that's how I am, and that's how I answer these things, and that's how I operate. So when he ejaculates in you, of course, we've always been, hop up and go pee, you're going to get a bladder infection. Well, okay, you can hop up and go pee, but can you not just lay for 10 or 15 minutes? Sometimes I would say stick a little, pillow under your bum as well. Just because he ejaculated, I would love to pull that semen at the cervix just to help these little swimmers get in there. You're going to get up eventually and pee, and you're going to get a little drippy. That's okay. You can't absorb all that semen, but if we can give the sperm a chance to get to where they need to go, I'm all for that. It's like giving them a little step ladder, right? I don't know. It makes sense to me. Okay.
Can I jump in really fast? We have a LH question. I know we've been talking about ovulation.
Go right ahead.
We had a question, what is the best time to test LH strips? And I know with pre-mom tests, we say to test late morning to evening, like 10 a.m. to 8 p.m. But it's different for everybody. The reason I know we say that, and I'm sure you'll back this, Linda, is like it takes a little while for the LH to build up in your urine. So that's why I recommend not doing first morning urine. For the ovulation test, pregnancy test, you do want first morning urine.
That's right.
But some women have had success testing with LH strips first thing in the morning. So definitely figure out what's best for you. But again, normally we recommend not first morning urine, go a little bit later, give that LH some time to build up in your body and try to stay consistent from day to day because you're looking for that progression. Want to add anything to that?
No, good point. Yeah, your LH surge does actually happen in the morning. And if you were to do a blood draw in the morning, you'd probably catch it. But of course, we're doing urine. So we need the afternoon to actually see it. It needs time to get to our urine. So Terry's absolutely right. Okay. My age is 35 and I don't have enough cervical mucus. This came up a couple of times too. Do you think I'll be able to conceive? So cervical mucus, if you're ovulating and you're having periods, you're growing a follicle, you have estrogen around. Estrogen is the hormone that slowly increases up until the point that we ovulate. And it's estrogen that changes the cervical mucus. Now, the cervical mucus lives in the cervix. And remember, I mentioned those swimmers need to get through. Normally, when you're not fertile, your cervix is like a stuffy nose. Nothing's getting in and nothing's getting out kind of thing because it does that to protect the uterus. The uterus is a sterile environment. And of course, the vaginal area is not. So it does that to keep it clean and healthy. So the mucus absolutely changes. There's glands in the cervix. So just because you don't see the mucus coming out vaginally, and I'm not a big one for digging to China, like get up there, girls, and reach and see if you can. No, not for that. Trust me, if you're ovulating, you have to have estrogen, and estrogen knows what to do. It changes your cervical mucus. That's why I'm not a big one. If somebody asked me, I would tell them, yeah, your mucus will change. It'll get that egg white, slippery, clear feeling around ovulation. But I'm not one to push for making that happen or doing the Mucinex and all that. Okay, what else we got? Can you have an LH surge and have it decline without ovulating? That's a really good question. And the answer to that is absolutely, but it's rare. It's called luteinizing unruptured follicle syndrome, something like that. It means, can I grow a follicle? Can I have an LH surge? And can I actually not ovulate? And yeah, you can. That's why again, I really like the BBT because you could grow a follicle. I mean, I'm PCOS and we tend to have a lot of little follicles on our ovaries. That's because they do all of this halfway growing and then stop because our hormones don't cycle normally. So that can happen. And yeah, you can have an LH surge and you might not ovulate. The BBT, the basal body temperature, takes a look at progesterone, and that's why your temperature raises, because you start to release progesterone, and the corpus luteum does that. So That's the old follicle. Once you ovulate, it turns into something called corpus luteum, and that's what makes progesterone, and that's what makes your temperature go up. So I like the BBT for that reason, because it helps ensure that we do ovulate. Okay. Why is it more, we need another hour for this one. Why is it more challenging to conceive over 40? Okay, I'm gonna be real quick. It's because your eggs, you have more abnormal eggs. You have more abnormal eggs at 36 than you did at 35. You have more abnormal eggs tomorrow than you do today because we're aging, okay? And our eggs have been with us since we were born, so they're 40 years old. So that's why it's so difficult to conceive after 40. It's simply because we do not have as many normal eggs as we used to. So yeah, I might be ovulating every month, but you know, if I'm 40, maybe 7 or 8 out of 10 are not normal. So of course it's going to take longer. I don't know which one it's going to be. So that's why you got to keep trying every month. That's the short answer about being over 40. Progesterone. What can help progesterone, increase progesterone when trying to conceive? So that's a rough one. Luteal phase defect. Luteal phase defect means I have a short luteal phase from ovulation until my period. Should be at least 10 days. You need that amount of time to implant an embryo in a healthy way. If it's less than 10 days, you absolutely need progesterone support. Again, your doctors can prescribe that, problem solved. Or if you just inherently have low progesterone, how would you know that? Usually you know that because you have a short luteal phase. What can you do over the counter? There's something out there called Vitex. Generically, it's called chasteberry. That is supposed to help lower prolactin and elevate progesterone. Some gals swear by it. Some say it didn't help at all. It's not something I don't think that would hurt you, so you could try that.
Right, just so you know, we have a couple of birth control questions. We've got another LH question. We've got, I don't know if you're planning on answering any of those questions. I just wanted to give you a heads up of what's coming in live.
Yeah, throw me some of those as well.
Okay. We just got one. Would you consider seeing a doctor 1 year and a few months of trying to conceive? We're both 25, no kids. The next Explanon, did I say that right? Was removed January 2020.
Okay, so that implant's been out for a year and a half now. You should be, your whatever your regular normal cycles are should be back by now. Sometimes it takes up to a year to get back to normalcy because when you're on birth control, your brain stops talking to your ovaries. That's how birth control works. Then you stop birth control. Well, these guys just don't start communicating perfectly normal again. They're trying to get back in sync. Sometimes it takes a couple of months. Sometimes it takes a year. Nothing you can do to hurry that up. It just is what it is, kind of thing. You know, if you want to go to a doctor and get put on medications to help you ovulate, you certainly could, but I'm saying naturally. So you're only 25 and it's taken over a year, then I would say that's too long. But have we really been trying at home? Like we're doing the LH test, the BBT, we're having sex in that fertile window, and it's great. It's textbook. I do it month after month. And yes, we're having the sex and the LH is happening. And after a year and we're only 25, it's not happening. Yeah, it should be happening. Something's going on. Blocked tubes, semen problems, I don't know what. But something is happening that a 25-year-old can't get pregnant a year if she's trying like that. And if you say, well, no, and I'm not doing that. I mean, we just haven't been on birth control. Well, then you need to start really trying. I know everybody thinks you just open a bottle of wine and have a date night and get pregnant. And a lot of women do that. And that does work. But trust me, I open a bottle of wine and have plenty of date nights. Back in the day, it didn't happen. So we only hear about it when it does happen. So that's the skewed nature of social media. Did that, Terry?
I think that's good. We have another one about the pill. This person it looks like got off the pill June. So that's what, 2 months ago? 2 months trying, asking when can she get pregnant? 2 months off the pill.
Oh, you can get pregnant 1 month once you're off the pill, you're good to go. There's no reason to wait. The issue is your body sometimes wants to wait because your body doesn't get back into sync. So if you're off the pill and you're having your regular cycles, just don't be alarmed in the first few months. If periods are short, periods are long, periods are light, ovulation was late, that's going to happen. That's not, remember, we're trying to figure out the communication thing again. So that's normal, but absolutely start trying.
You want one more? We just got another birth control question.
Let's knock those out.
It's a popular topic. I was on Depo-Vera for about 6 years, stopped in August of last year. Got pregnant in April and miscarried in June. Could that have been the cause of my miscarriage?
Being on birth control? Is that what that sounds like the question is?
Yes, being on birth control. Could that have been the cause?
Absolutely not. It was not due to birth control. No. You got pregnant, so you're ovulating. Remember, I was talking about being over 40 and having abnormal eggs, but the reality is even a young girl in her 20s and early 30s, I mean, half of her eggs are abnormal. So every other month, statistically, we ovulate an abnormal egg. Now, most of the time, we just don't get pregnant with those, but sometimes we do. And that is why we have miscarriages so frequently, if you will. 25% of pregnancies that we know of are miscarriages for that reason, because we have so many abnormal eggs going on. That's why miscarriages happen by and large, not at all because of birth control.
Okay. You want to do a couple more advanced ones and then we can jump back.
All right, let's see. Somebody's asking about PCOS. This is always a popular topic. Is PCOS a diagnosis? It's definitive, yes or no. And if you have it, you have it. Is there a spectrum of severity? Doctors say I have it, but I have mild symptoms. So PCOS, yeah, is very complicated. Pretty much it's not curable. And if you've been diagnosed with it, you have it for life. There's no way to get rid of it. It's called a syndrome because we have it forever. Lucky us. So it's just PCOS it's just really, yes, there is a spectrum of severity. I'm going to, me, I talk about my personal stuff. So I'm a classic PCOSer and I went through the spectrum of severity. And you know what? This is me, but mine was really weight dependent. If I was, and I'm a little short girl, so if I was over like 160 pounds, slowly my periods would stop going away. And Lord help me if I got close to 180 or 200, I had no periods at all. None. Wouldn't have them. And then I would lose weight and all of a sudden the periods might start to come back. And if I got under 150, they came back with a little bit more regularity. And I've got 3 children in life and had a miscarriage. So I've been pregnant 4 times and I'm a classic PCOer. So my severity really depended on my weight because the more fat tissue we have, which by the way, it's really easy to get fluffy when you have PCOS. We're so lucky. So it's hard to lose weight too. It's easy to gain weight and hard to lose weight. But that fat tissue, adipose tissue, holds on to estrogen and that converts to testosterone. So it's a really complicated hormone feedback system that I don't even understand. But there is something to be said about changing your weight when you're PCOS and helping you ovulate.
Well, I have a follow-up to you.
Please, go.
Someone asked, how do you know if you have PCOS? I peaked between 20 to 22 days this month, and it was day 27 when I peaked.
So, yeah, probably the most popular symptom of PCOS is irregular ovulation / periods or absent ovulation / periods. So, there are a lot of gals who are just, I always call them regularly irregular. So they might have periods that go anywhere from 35 to 50 days, but they have them. They don't, she doesn't know how exactly when. That could be a symptom of PCOS, but there's a lot more that go into PCOS. Getting your labs, your hormones drawn will be a big factor in helping diagnose PCOS. Getting an ultrasound to look at those ovaries, which tend to have a whole bunch of little baby follicles, polycystic, sitting there on the ovaries. So there's a couple of ways to diagnose it, but having irregular periods is the first symptom that usually happens. Okay, how about, let's see, what signs to look for when you're about to ovulate? So symptoms about to ovulate, well, that cervical mucus that we talked about a few minutes ago, oftentimes it's almost like sometimes, I can remember way back that you would pass that really slimy cervical mucus and it's like, am I bleeding? Did a period start? And it's just this mucus. That's often a symptom. Sometimes you can feel it. Some gals have what's called Mittelschmerz, which means when you ovulate, it's a German word, obviously. And you actually can feel it. I never could. I never knew. But some gals will say, yeah, hold on. There it is, right on the right side. I just ovulated. She can feel it. She has pain, ovarian pain when she ovulates. Sometimes you can have a little bit of spotting when you ovulate too. That's very normal. So those are symptoms, I would say, of ovulation.
I'm going to throw in 2 after that that are kind of related. Someone asked, can drinking during ovulation affect conceiving?
No. Nope.
No.
Easy. I'm not going to tell you can't have a glass of wine, though. So look for me to tell you. No lectures here.
And then we have one, I'm not sure if I really ovulated. LH peak was CD12, cervical mucus was raw egg white, all good so far, but BBT spike was on CD15. That's all sounds good to me.
It does. Remember, I mentioned sometimes, and remember, these are all vary, especially BBT. But again, look for a general theme. Did that BBT, does it continue to stay up after you ovulated? Then don't worry, you did ovulate. I don't know, it took a day or two for it to go up because again, it's dependent on progesterone. When did the progesterone release? When did my body respond to the progesterone? So these things can take a day or two. I'm with Terry. That sounds like great ovulation to me.
Good job.
Another one? Got another one?
Oh, I was saying good job for that body. Your
Absolutely.
Looks great. I don't know if I have anything else well, this one we've kind of talked about. LH test, when you hit your peak and the next day you hit a high, does that mean you're ovulating now or will it be the next day?
Good question. So this is by far the most confusing thing is this whole high, peak, what's going on? Because you know why? High usually means like in real life, it means like peak. Oh, I had a high LH. I would think you meant you surged. Okay, but the app, I literally want you to ignore lows and highs. And there's a caveat to that. I like highs before you ovulate because sometimes that's giving you a clue you're about to ovulate, but not always. But again, it doesn't matter what the lows and highs are. Just look for the peak. Some gals will go high, the next day high, and then they'll peak. Then they'll come down and they'll do a high, one more high, and then they'll be low. Some gals go low, peak, low. I don't care. Doesn't matter. You had a peak, you had an LH surge. It has one job, and that's to release the egg, and it did. I don't care what happens around it. That makes sense?
Yeah, it's good. Can I ask a miscarriage progesterone question?
Of course.
I've had 2 early miscarriages. For my next pregnancy, should I have my doctor check my progesterone? Will my next pregnancy be high risk?
Okay, so I'm sorry. We had 2 miscarriages.
Early.
Okay.
For my next pregnancy, should I have my doctor check my progesterone? Will the next pregnancy be high risk?
Okay, yeah, that's a good question. No. So when do miscarriages seem to be a problem? Because I just mentioned earlier, they're really like 25% of people have them, and there's nothing wrong, so to speak, right? So they say when you have 3 miscarriages in a row, and what I mean by in a row, I mean no live births. If you have a live birth, that erases all the miscarriages that were before that. So if you're somebody who trying for a year, and in the last year, I've had 3 miscarriages. 3 is kind of the number that you start to look into. And again, by the way, 2 could be a problem. 5 could not be a problem. Right? These are all averages. Most often miscarriages are what I mentioned earlier. They're due to chromosomal abnormalities in the egg and therefore the embryo. So we either don't get pregnant or we miscarry the pregnancy. But there are times when the woman's body is responsible for the miscarriages. It could be an implantation issue. It could be an immune issue. It could be your body attacking the embryo. It could be a low progesterone issue. So, listen, if you want to go get tested before you even start to conceive, I certainly have no problem. I would probably do that because, again, I'm type A and OCD. I want to know right off the bat, are my tubes open? Are the sperm good? Before I start wasting all my time doing this. I know insurance may or may not pay. Okay, so I'm going to say I tried for a year. Anyway, I'm not worried necessarily about 2. I'm really not. But if you want to go get your progesterone tested, by all means, I wouldn't necessarily send you to go do it just because you had 2 miscarriages. And no, when you do get pregnant, it's not high risk. Miscarriage would have nothing to do with being high risk.
All right, let me throw you one more. You might even have touched on this. What are your thoughts on testing before a missed period? I know the recommendation is to not test for pregnancy early and just wait for a missed period, but if you're having repeated chemical pregnancies and that's valuable information for your doctors, how would you know if you don't test early?
Okay, so that's another good question. I saw that earlier too. So sure, chemical pregnancies are real pregnancies. they call them chemical just because they've only been verified chemically in the test. We didn't go get an ultrasound and see a heartbeat, right? So usually chemical pregnancies are losses that happen somewhere in the 4 to 6 week area. It is absolutely true. There are plenty of women who miscarry or have chemical pregnancies, and they never even knew they were pregnant because they didn't even miss a period yet, or maybe their period was like 1 or 2 days late. But that was really a chemical pregnancy. So regarding, should we test early? I can only tell you that you have to balance your level of patience over your level of disappointment when you see negatives early on. Because I'm telling you, and every day I tell people this, yes, there are girls who have gotten positives at 8, 9, and 10 DPO. And trust me when I tell you, they post about it. Good for them. But there are many more that do not get positives that early, but don't get positives until 12, 13, 14 DPO. So again, if you can, I just see the disappointment when they see those negatives. I know they think they won't be disappointed, but they are. So you have to, but if your impatience is making you as crazy, that's on you. You decide what you want to do. But no, I'm not worried about you learning more about if you have chemical pregnancies, because again, mostly when you get pregnant, you lose them after a missed period anyway.
One more question. Sorry, I meant to type the answer.
Go right ahead.
You were talking about how you mentioned earlier how you recommend sex every day. Someone asked about how about 2 times a day? Does it matter if you do it more than once a day?
No, I don't think there's advantage to that. I mean, there's not. I mean, if you want to, you can. But I mean, I don't think there's an advantage. At some point, we got to go enough's enough. So I think daily intercourse gives you enough sperm to do the trick. I think if I were able to count up all the sperm that you got in your body in 5 days of daily intercourse, I believe that's more sperm than if you did it every other day. Do I think that would double if you did it twice a day? No, I do not. I mean, the poor guy's got a surplus. Granted, they make sperm constantly round the clock. So they're making sperm all the time. Now they make it 2 to 3 months ago, but I mean, I don't think they have that. So no, I don't think there's an advantage in that.
Okay. So she was saying he wants to do it more than once a day.
Then you got to deal with him. That's on you. Yeah, you can't. Won't hurt anything.
But, all right, let's do some more advanced ones.
Okay. All right. So this is a really complicated question too. Well, you know what? Let me do an easy one first. I got a gal who's PCOS who's asking, is it possible, this is a good question, is it possible to have ovulated and then not have a period? And the short answer to that is no. Pretty much. Now, nothing is 100%, but if you get a period, I mean a real period, not breakthrough bleeding or spotting, but you get a real period, you most likely like 99% ovulated. That's how, when somebody says, I don't know if I'm ovulating, but I have periods every 28 days, you're ovulating. So is it possible to have ovulated and not have a period? Yeah, if you're pregnant, you won't get a period, but no, the periods are a reflection of the ovulation you had. So that was my easy one. A gal asked, she's got endometriosis. She wants to know what can be done to decrease inflammation due to endometriosis besides diet and exercise. Endometriosis is the B word. It's rough. It's rough. It's rough, just like PCOS. And about 10% of the population have PCOS and 10% of the population have endometriosis. Endometriosis is very painful. The biggest thing I can say, and there's so much not known about endometriosis, is go with good antioxidants, things that will help anti-inflammatory. Turmeric is like the number one. Be on turmeric for sure. Vitamin D, resveratrol. What else? There's other good antioxidants. I have a list around here somewhere. I wrote some down. Fish oil, CoQ10. So those are the kind of things I would suggest. But it's a bear, endometriosis.
We actually have an endometriosis question live too. Okay. They wanted you to discuss endometriosis. So awesome, perfect. And then can we discuss this as well as BV?
Oh, bacterial vaginosis. Okay, well that's different. Yeah, I'm sorry, were those two separate questions?
They were put together.
Okay, so yeah, endometriosis, you can't diagnose it unless the doctor's done a laparoscopy on you. He actually has to go in into the abdomen with a scope and see it. You can believe you have endometriosis. I mean, if I have gals who have debilitating periods, like they miss a day of work or school, or they sleep with a heating pad for 3 nights, or their life stops for a couple of days because of the pain, that sounds like endometriosis to me. If you tell me, yeah, my mom had it, my aunt has it, my sister has it, then, you know, there is a genetic component. It sounds like you might have it. Endometriosis is due to retrograde menstruation. That means sometimes instead of going out through the cervix and having vaginal bleed, sometimes blood escapes through the tubes. Probably happens to all of us, but some of us are prone to letting those little deposits land wherever they land in the abdomen, outside of the uterus, outside of the ovary, outside of the bowel. And just like your uterine lining grows every month, those little deposits will grow. And some people are prone to that. Those are the ones who have endometriosis, and some aren't. But we all probably have some form of retrograde menstruation. So you do suffer, that's for sure. You have it for life, just like PCOS. You have to go get those little deposits lasered off if you want any relief, and they come back. Does endometriosis mean you're going to have a tough time getting pregnant? The short answer is probably not. The long answer is could be. Why? Well, because this is all very complicated. Usually it's immune system based. Your immune system is either hyperactive and trying to clean this all up, and that could lead to implantation dysfunction. If you have endometriosis and you're somebody who has recurrent pregnancy loss, you get pregnant all the time and you just keep losing it, it might be due to endometriosis. But now you're starting to get definitely into physician level stuff. Bacterial vaginosis. I just had a gal ask me a question today. Poor thing. She had got a yeast infection, took yeast medication. Of course, she's trying to conceive, and she was still symptomatic and went back to go have a check. Now they diagnosed her with bacterial vaginosis, and she got more medication. She was asking, you know, I really don't want to take this if I'm trying to conceive. I can't stress this enough. Your health is number one over anything. So please always get yourself well. If you have a UTI, if you have BV, take the medicine. I'm more worried about you not getting pregnant because you're not at your healthiest. So that's most important. So that's what I would have to say about BV.
Awesome. What else you got?
Okay, somebody says, I'm 28. I'm wondering what are the chances for me to conceive after a D&C? Probably had a miscarriage, had a D&C. So, you know, listen, we've all heard, you know, too many D&Cs or too many abortions can not be healthy for the uterus. And that's true because you can cause damage when you go in there and, you know, they're scraping out and cleaning out the uterus. Again, for whatever reason, doesn't matter why. That could do damage. You could do damage to the uterus. Again, that's one of those, it's a long shot, but it can happen. So I can just tell you, you know me, I'm sharing. I told you I had a miscarriage. I had a miscarriage about 11 and a half weeks. Cruel, right? You get right up to the end, think you make it, and then you don't. And I had a D&C. That was my choice. I just didn't want to pass it and experience it. So I chose to have a D&C. I got pregnant about 6 weeks after that D&C, before I even had another period, before I even remember PCOS. I don't know when I ovulate. Well, I apparently ovulated, and she's now 24 years old. So yeah, you can get pregnant after a D&C without a problem. You don't have to necessarily wait. Somebody asked, how many days after a peak should my husband and I continue to have sex? Again, I recommend, if you said, look, I can have sex twice, have sex when you peak and have sex the next day, because that's when you ovulate. If you can, have sex a few days before this and have sex after you ovulate too, because that egg is around for 24 hours. Somebody asked, should I be concerned if I have a short luteal phase? Yes. Let's define. Again, I want a minimum of 10 days from ovulation until your period. If anything less than 10 days, 8 or 9 days, it's too short. You need to see your doc because he needs to put you on progesterone supplementation because you don't have enough around to keep you from having a period. This is going to be an older gal. She's 45 and she wants to know if she should even bother with treatments like Gonal-F or any of those medications. So, all right. So at 45, you have less than a 5% chance of getting pregnant naturally, maybe like 3% chance. Of course, it all depends on what your hormone levels are. That's not the bigger problem. The bigger problem is your eggs are 45 years old. So again, why not try? Just set yourself up to know what your chances are. 3 women in 100 are going to get pregnant at 45 when they're trying. Now, if you go do IVF or something like that, have you increased your chances? Absolutely. IVF will increase everybody's chances of getting pregnant. Do you want to spend, $15,000 on a 3% chance, or if I bumped it up to 5% with IVF, you can. That's on you. It won't hurt you to try, but just be real about things. That being said, I'm going to share. I have a 14-year-old, had a baby at 45 naturally. Wasn't doing anything, wasn't trying. What was I trying? Well, I was having sex. And who has birth control at 45? I don't. And I have PCOS. So yeah, and I did. I got pregnant at 45. So yeah, it does happen. So you keep trying, just set yourself up. Don't ask what's wrong. You know what's wrong. Pregnancy question, what week will I start to see a heartbeat? Usually you don't see a heartbeat. Don't count on seeing a heartbeat till you're at least 6 weeks pregnant. By then you should be able to see a heartbeat. What does it mean when LH levels are high, then go low and high again? Well, like I mentioned earlier, that's going to happen. I don't care. It's going to go low, high. It zigzags around. Don't pay any mind to that. Wait for that peak. You got anything for me, Terry, there?
Yeah, can I jump in?
Please.
Someone had a pregnancy/premenstrual symptoms question. I have pimples on my face. How can I identify if it's due to pregnancy or premenstrual symptoms?
That's a good question. You know what? You can't, and here's why. PMS is due to progesterone. Pregnancy symptoms are due to progesterone. That's why so many gals feel like, for a gal who's not trying to get pregnant, when she's like, 3 or 4 days before her period, she's going to tell you, oh man, I feel lousy on PMS. Take a gal who's trying to conceive and she has the same symptoms. She's going to be like, you know what? No, I mean it. This time, I think I'm pregnant. It's the same symptoms. Sometimes they're worse when you're pregnant, but the truth is it's just progesterone. So it really is hard to tell. It just depends on mentally where you're looking at it from.
But if I take a prenatal, will that help me get pregnant faster?
That's a really good question because we get that a lot. No. People always ask me, what's the best prenatal I can be on to get pregnant? Well, okay, there's an answer to the question. What's the best prenatal for me that, gives me what I need, et cetera? They don't help you conceive. They get you to a healthier state, certainly. But unless they're not going to take you out of the gutter if you're unhealthy. But sure, take a prenatal with folic acid, DHA, vitamin D. They all have that because I want you to be healthy and have enough folic acid around when you do get pregnant because that helps prevent spinal development problems in the baby. But no, a prenatal does not help you get pregnant.
All right, how about one more cycle question before you go back to the advanced ones? LH levels and intense cramps on right side seem to confirm that I ovulated today, but not really any dip in BBT. In past months, there was an undeniable drop in my BBT beforehand. Can your usual BBT cycle vary from month to month?
Absolutely, because your temperature can change. Again, we talked about like the BBT dip with implantation. Some get it, some don't. The BBT sometimes will dip at ovulation and then it goes up within a day or two afterwards. Again, if it didn't dip, I don't care. I do want to see that BBT go up sometime after ovulation and stay up. That's my confirmation that you did ovulate. Sounds like you did because of your LH and the right-sided pain. You're having middle schmerz.
Cool. I'm going to do a couple more advanced questions.
I'll look for a couple more. Let's see. A lot of PCOS questions again.
Maybe for PCOS month, we could do like all PCOS questions since that's coming up.
We would have plenty of people who had questions, that's for sure. Here is, let's see. Is there anything I can do during the 2-week wait to improve my chances of conception? Right? That's like a magical question and there really is no secret answer. The 2-week wait is horrific. I really am a big believer in, of course, first, let's say this is all assuming your progesterone levels are fine. You have a normal luteal phase. It is so out of your hands in the 2-week wait. There is nothing you can do to make it happen at this point. You've ovulated, you've had your sex, your 2-3 DPO, you're starting your 2-week wait. It is out of your hands. The egg and sperm will do whatever the egg and sperm are going to do. And then that embryo, if you make one, will do what it's going to do. And there isn't anything you can do about it. Just release that control. You're just a bystander now. I'm this believer in stress. Now, of course, it's going to be stressful. Of course, you're going to worry. But if you understand and you keep telling yourself, let it go, just let it go. That's why I'm not a big fan of starting, home pregnancy tests at 8, 9, 10 DPO, because that really does raise your stress levels. So I don't like that. There's not a lot we know about stress and the hormones it does. There's a lot we do know, though. I'm not going to say relax, but just own the fact that it is out of your hands.
Here's a great opposite question. So you said you can't really do anything about it positively, but someone's asking about alcohol during the 2-week wait.
I'm supposed to tell you not to have any, right? The truth is okay, firstly, let's say everything in moderation, right? Don't tie one on. Don't tie one on anytime when you're trying to conceive, just because I don't think that's good for you. Right? Have you had a hangover? There's a reason you feel that lousy. You've poisoned your body. So no, if you tell me, look, it's my sister's birthday. I was going to have a glass of wine. I'm 5 DPO. Is that okay? Of course it's okay. That's my opinion, by the way. You just have to be smart about it. That's all. Don't tie one on. Don't overdo it. You haven't even probably implanted yet. You're not even sharing a blood supply with the baby yet. Again, if you worry more about that, I worry about that more than I do the glass one. Go ahead. You want me to take some here?
Yeah.
I might be getting towards the end of mine because there's just a lot of that. Yeah.
Good job. We had so many.
Okay. Somebody asked, any tips for boosting male libido during my fertile window?
Oh, we had that one live too. Good.
Yeah. We have a hard time having intercourse several times within a short period. Well, you better ask him about that. Look, you got to do whatever you got to do. He knows. If he really tells you I can't, trust me, walk away. Asking him and telling him, I do this every day. Are you kidding me? All I'm asking you, okay, don't do that. I've done that. I know. Because there's nothing worse than having sex when you're mad at each other. But the reality is yeah. You're going to have to listen to him. I'm sorry. He really is in control of this part. So, yeah. Don't have any magical answers. Okay, what you got for me, Terry?
Yeah, this person, it might be the same person, is asking about any vitamins or anything you suggest for libido.
Well, I do suggest that all these men that you're working with over here to try to get pregnant, all your partners, go on the internet. I don't care what it is, but you can find male fertility blends. Because remember, men and women are completely different in this regard, right? Men make their sperm every 2 to 3 months, so they have all this fresh baby sperm all the time. And women don't. We're born with our eggs. We've had them since we were, born. Well, the good news there is there's not a lot you can do to hurt your eggs. They're already there. There's thoughts about, smoking and all that kind of stuff is bad for your eggs. And sure, I believe that's bad for everything. But in general, your eggs are your eggs. But men's sperm can vary every couple of 3 months. If he was like a really bad boy and was, sat in a hot tub after a 20-mile bike ride and he wears his Speedo while he's in there and he's smoking and drinking heavy, yeah, that's going to absolutely impact his sperm production. If he's really stressed, these kind of things. So that's why I always want men on some kind of fertility blend. It's really mostly antioxidants. Just because, again, they're always making sperm. So generally men's sperm don't go up and down like good, bad, but he certainly can take a dip and he certainly can make a little bit better with some good supplements and stuff. So that's your best bet. Is just go buy a fertility blend. He's not going to want to take a ton of pills anyway. Trust me.
Okay. Do you want me to go with live questions now?
Girl.
Okay. I'm just going to make a quick announcement that we have 9 more minutes. So we're just going to run through as many questions as we can. Thank you for participating. If we don't get to your question, you have a couple options, as we mentioned in the beginning. You can come back next week. You can get an answer right away through Ask an Expert on your homepage, or if you have a membership that has Ask an Expert as one of your perks, you can ask that way and get an answer in 24 business hours or less. But let's
virtual consult.
Virtual consult. Thank you. Yes, so many options. So whatever you need, we have it for you. And let's go. Ready? Let's go.
9 minutes countdown. Thank you all for coming.
Yes, you guys are awesome.
But I know you're all there.
Yes, I can see the number. Let's see. Okay, how do you know when your cervix is open if you have a tilted uterus?
Doesn't matter. First of all, again, my advice, keep your fingers out of there. I don't want you poking around trying to, I know some people believe in this, but you guys are talking to me, so you have to hear what I have to say now. I'm not one for doing that. There's this whole thing about stick your fingers up there and try to figure out if your cervix is this or that. You know, remember I told you earlier, the cervix is the opening to the sterile uterus? Yeah, keep your dirty fingers out of there. I don't think it's important to know. A tilted uterus doesn't impact anything. It's like I have blonde hair or brown hair, doesn't matter. Might matter when you go into labor one day. If you have a retrograde uterus, you have more back labor or something, but it doesn't matter to conceive. You're fine.
All right, this next one, I don't know what this is. How do you know if you have cervical stenosis?
Cervical stenosis means that it's a really tight cervix and it's hard for something to get through. How do you know if you have it? I don't think you would know. Don't worry. When you ovulate, that estrogen goes in there and it will open up. Again, you can't but help respond to the hormones if you have them. If you have the estrogen, if you grew a follicle and you ovulated, your cervix did the right thing. Sperm will get through. If you were trying to have a procedure like a hysteroscopy where they put a scope up through the cervix, yeah, that could be a problem. They use dilators then to help open it up type thing, but it won't impact conceiving.
Okay. Is it important to know you've had a chemical pregnancy?
Yeah, I think it is. I mean, again, if you're going to be, unfortunately, one of those gals who's going to be diagnosed with recurrent pregnancy loss, meaning you have 3 or more miscarriages, then it could be. It could be important to know that. But again, chemical pregnancies, when you get pregnant, you don't tend to lose them before your period. You probably implant like around day 8 to 10. And then if you're going to have a period, it would be like 4 days later, so usually not. Usually chemicals are late periods, missed periods. So as long as you test when a period is due, 99% of the time you're going to catch if you had a chemical pregnancy.
Does aspirin and I have something on my computer. Heparin injection have any side effects on pregnancy? It was recommended for an ex-pregnancy, had miscarriage last month.
So when I worked in an IVF clinic for 20 plus years, and there were times we used aspirin and heparin. So no, aspirin and heparin are not dangerous to pregnancies, or we would have never used it. It was used for implantation issues. And again, you have an implantation issue if you have recurrent pregnancy loss. You just keep, no problem. This is usually the story. I have no problem getting pregnant. I get pregnant whenever I want. I just keep losing it all the time. And again, these are gals who will have 3, 4, 5, 6. So that's really what I mean more by recurrent. And the docs will start looking at putting them on a baby aspirin a day or getting heparin or Lovenox injections. But please do me a favor, do not self-medicate, okay? Because again, aspirin is actually a pretty serious medication, and I don't want somebody on that if a doctor hasn't actually told you to go on it when you're trying to conceive.
What are your thoughts on Geritol multivitamin? I've seen a lot of success stories of women getting pregnant faster after taking these.
Wow, Geritol, that's like my generation.
I don't know what it is.
Yeah. I don't know what it is. Yeah, if you're old, you know what Geritol. You used to have Geritol commercials like during the, Art Leak Letter show and stuff like that. Anyway, so I've never heard that Geritol. Let's just address any multivitamin. I said this earlier. Terry asked me, could a prenatal vitamin help me conceive, or which one would? Now, here's what happens. Here's why you get this skewed information. You take 100 women who use Geritol, and 10 of those women, regardless of whether they're on Geritol or nothing, they get pregnant. Well, those 10 go on and they post how I was on Geritol and I got pregnant. The other 90 who are on Geritol and didn't get pregnant, they don't really have a reason to post about how I was on Geritol and didn't get pregnant. So all you see are the people who took Geritol and got pregnant. So now you think everybody who takes Geritol gets pregnant. And that's just not the way it is. You're just not hearing from the other people.
Good reminder. Someone's asking about COVID-19 vaccine and ovulation. She was supposed to ovulate a few days ago, but not getting the LH surge and was vaccinated during the last period. Can those be connected?
Yep. We don't know how or why. We just know that COVID-19 vaccine is somehow having an impact on menstrual cycles, not with everybody, but with enough that it's become significant. It's kind of like, how you've been hearing like people who get the vaccine are more prone to blood clots or something, right? So there's a higher percentage of people who are having menstrual changes after the COVID vaccine. I have heard that it does eventually go back to normal, but remember the vaccine how long has the vaccine been around, Terry? I mean, since like January or something, or?
I know they've been working on it for a while, but yeah, I think it was released around January or February. Yeah.
So, I mean, what are we talking about? The vaccine's been around for 6 months. So how much can we know of the general population that takes it? But I will tell you that we are, and whenever there's changes in periods, what that really means is there's changes in ovulation. A period is absolutely tied to ovulation. So if you have a late period, what that really means is you had a late ovulation. So yeah, we're not sure how or why, but it seems like the COVID vaccine is impacting sometimes menstrual cycles, ovulation, etc.
Okay. I think we should probably wrap up there because we have so many questions. So I just want to thank everybody for coming. And Nurse Linda, thank you for hosting, for answering all these questions.
I could stay here all night. You guys know that, right? We could send Terry to bed and we could all just hang out together because I love doing this. So, and I love answering your questions. I love doing virtual consults. It makes a really big difference when you get either a one-on-one in questions or in a virtual consult, because I really think that I can help you relax. You guys asking these questions, I'm helping you relax because you're getting answers. Things aren't as tightly wound as you usually think they are. So it helps to hear somebody tell you that. But thank you for coming. I really appreciate it. And I hope that this was helpful in some ways for you guys. That makes me sleep well at night. I want to know there's babies being born out there because I helped you.
Yeah, and I wanted to share this with you because the Q&A is going to disappear. It says, Nurse Linda, you're so awesome. Love your upfront honesty. Wish you were my nurse.
Oh, I am your nurse. I am. You have me. I'm yours.
All right. Looks like we're getting some thank yous. Also, this was great. Great. So as we said in the beginning, please share this with other people in the pre-mom and app community or that you know, because we will keep doing this as long as we know there's an interest and we're helping you. So we got to make sure people are coming so that we can help as many people as possible. All right. Have a good night, everybody.
Love you guys.
Thank you.
See you later. Bye-bye.